This video is going to be about which nutrients and supplements have the best track record of improving high blood pressure, also called hypertension. High blood pressure is not to be taken lightly and can cause many bad things such as stroke, heart failure, chronic kidney disease and vision loss. Some of the primary risk factors for hypertension are stress, alcohol intake and obesity. According to the World Health Organization, hypertension is the most important preventable risk factor for premature death worldwide. In this video, I'm going to address what can be done from a nutritional perspective to treat or prevent hypertension. When talking about high blood pressure and nutrition, the focus is normally on sodium restriction, but in this video I want to talk more about the nutrients that are worth increasing your intake of. The first nutrient I'm going to talk about is potassium, which has a very consistent track record of reducing hypertension. I was able to find 7 meta-analyses looking at potassium supplementation for high blood pressure. Meta Analyses is basically where the data from numerous studies is aggregated and all analysed together. All of the meta-analyses that I looked at found that potassium supplementation reduces blood pressure in hypertensive patients. That represents an amazing level of consensus on the topic. In short, potassium supplementation has a thoroughly proven track record of improving blood pressure in hypertensive patients and should be one of the first things that patients with high blood pressure try. Some good sources of potassium are avocados, bananas, potatoes, spinach, beans, citrus fruit and fish. And if none of that sounds appealing, you can take potassium tablets. I would recommend taking about 4 grams per day. Obviously, the advantage of getting potassium from whole foods is that it will come with many other nutrients. But for the purpose of treating hypertension, the important point is just to get the potassium one way or another. The next nutrient that I'm going to talk about is magnesium. I was able to find 5 meta-analyses on magnesium supplementation and hypertension. 4 of these meta-analyses found a beneficial effect of magnesium supplementation, but 1 didn't. I'd say that people with hypertension should consider supplementing with magnesium because it's very safe and there has been a lot of success in clinical trials. Some foods that have magnesium are green leafy vegetables, legumes, nuts, yogurt or kefir. If you want to supplement, I would recommend taking 400 milligrams of magnesium glycinate per day. The last nutrient that I'm going to talk about is vitamin D. There have been numerous studies on the effect of vitamin D on hypertension, but the evidence that it works is not as strong as with magnesium or potassium. I was able to find 4 meta-analyses on vitamin D supplementation and hypertension. One found a moderate reduction in systolic blood pressure. Another concluded with weak evidence to support a small effect of vitamin D supplementation in hypertensive patients. The next one decided that vitamin D may lead to a reduction in systolic blood pressure but not diastolic blood pressure. The last one didn't find any effect and concluded that vitamin D is ineffective as an agent for lowering blood pressure. So from all that, I think vitamin D may have a beneficial effect in hypertensive patients, but it's probably not going to have a huge effect. Vitamin D can be toxic in excess, so if you want to supplement, I would suggest about 3000 IU per day. The next thing I'm going to suggest may not be the most popular, it's alcohol reduction. In studies, alcohol reduction has consistently had a beneficial effect on blood pressure. I found 3 meta-analyses on alcohol reduction and blood pressure, and all of them found that alcohol reduction reduced blood pressure. Another thing that I wanted to mention, which isn't technically nutrition, is meditation. I was able to find 3 meta-analyses on meditation and blood pressure, and all of them found that meditation had a blood pressure lowering effect. Some quotes from the conclusions were, meditation may serve as an alternative approach for lowering both systolic and diastolic blood pressure. The regular practice of transcendental meditation may have the potential to reduce systolic and diastolic blood pressure by 4.7 and 3.2 millimeters of mercury respectively. These are clinically significant changes. And finally, meditation exercise could decrease systolic and diastolic blood pressure. So that concludes my tips for hypertension. The things which have the most evidence for efficaciousness are potassium supplementation, magnesium supplementation, transcendental meditation and reducing alcohol intake. Vitamin D has a more mixed record in studies. it is safe to try unless you go really crazy.